The morphology of atherosclerosis means the macroscopic and microscopic appearances of atherosclerosis. The first morphological presentation is fatty streaks. Fatty streaks begins as minute yellow flat macules that can blend with each other to form more elongated lesions of 1 centimeter or more. Because those lesions are small and minute, even if they cause little elevation within the vascular wall, they won't cause any significant flow disturbance. Fatty streaks are composed of lipid-filled or stuffed foamy macrophages, so those macrophages engulfs lipids. Fatty streaks present in aortas of infants younger than 1 year, and in virtually all children older than 10 years regardless of their genetic, clinical, or dietary risk factors. The relationship to atherosclerotic plaques is unclear or uncertain because those fatty streaks, some of them may evolve into the plaques, but not all of them should progress. This figure demonstrates the macroscopic and microscopic appearances of fatty streak. And as we said, fatty streaks are minute yellow lesions that cause no flow disturbance. Usually they are present at the branching points of major vessels. The figure at the top shows the macroscopic appearance of the fatty streak in the aorta. So here, as you can appreciate, the aorta shows a fatty streak mainly near the ostia of the branched vessels. Look to the arrows. The figure at the bottom shows the histologic or the microscopic appearance of fatty streak. As you can appreciate, the arrows points into lesion that is present at the intima, the innermost part of the vascular wall. Those are foamy macrophages or macrophages that are stuffed with lipids. This is the histologic appearance of fatty streak. Atherosclerosis can also present as atherosclerotic plaque that we discussed before. Those lesions are raised lesions, so usually they cause disturbance in the blood flow, white to yellow in color, and range in size from 0.3 cm to 1.5 cm, but those lesions also are able to blend with each other, forming much larger lesions. Usually only portion of the vascular wall is involved, and they are eccentric within the circumference of the blood vessel with patchy distribution. Many vessels in our body can be involved by fatty streaks and atherosclerotic plaques. However, there are vessels that are more extensively involved. In a descending order, the most extensively involved vessels are the infrarenal abdominal aorta, followed by the coronary arteries, followed by the popliteal arteries, followed by the internal carotid arteries, followed by the vessels of circle of Willis. Furthermore, atherosclerosis typically is more severe in the abdominal aorta if compared with the thoracic aorta. Some vessels in our body are spared, not involved by atherosclerosis. One of those are the vessels of the upper extremities. Also, the mesenteric and renal arteries are considered spared, not involved by atherosclerotic plaques except at their ostia.